Sky News can reveal serious breaches of COVID-19 protocols at the Royal Darwin Hospital, which clinicians admit have put the public at risk of a COVID outbreak. Let's go live now to Matt Cunningham in Darwin. Matt, what's been the nature of these breaches?
Well, Laura, I've spoken to several independent sources who have revealed that patients who have been transported to Royal Darwin Hospital for treatment have ended up basically wandering around the emergency department at the Royal Darwin Hospital unsupervised. Now, those patients, when they're sent from Howard Springs during their quarantine period, are meant to be kept in an isolated decompression room and they're meant to be supervised. However, whistleblowers I've spoken to, and this has now been confirmed by the health department, say that there just hasn't been enough staff at the hospital to supervise these people on a full-time basis, and so they've ended up just walking around the emergency department. In fact, in one case I was told that a woman was found by nurses in the resuscitation room at 3 a.m. One whistleblower who we spoke to said the potential for a full-blown COVID disaster in the near future is extreme. Now, we did put a series of questions to the Northern Territory's Health Department. They have responded. What the Health Department says is that patients are clearly advised of their requirements to remain in the decompression room. However, in response to non-compliance, which we've now revealed, security staff are now also stationed at the decompression room to provide additional monitoring support to staff. Some pretty serious incidents that have been reported now at the Royal Darwin Hospital, Laura, and it's fair to say that some of the staff that are working in that facility are seriously concerned about what's been going on there.
Well, it sounds pretty concerning, Matt, I've got to say, and the Northern Territory is receiving the bulk of repatriation flights from India. So what's the potential impact of this on the Royal Darwin Hospital?
Well, this is another area of concern from staff I've spoken to from the hospital. We know that those flights were paused about 6 weeks ago. Now, the main reason for that pause was because of concern within the hospital. The hospital would not be able to deal with a high number of cases. The Chief Health Officer has since revealed there's just 2 ICU rooms at the Royal Darwin Hospital. So if we were to get a serious number of cases, you'd have to question the hospital's ability to deal with those cases. Staff also say they're concerned that the Northern Territory government has taken more than $500 million from the Commonwealth to run the Howard Springs facility and receive these repatriated Australians from overseas. But they say that not a cent has been spent on upgrading facilities at the Royal Darwin Hospital, and that's creating a dangerous situation, including, according to one clinician I spoke to, he said it's like a game of Russian roulette, and every month we put another bullet in the chamber. Some pretty serious allegations there coming from staff within the Royal Darwin Hospital. We are expected to hear from the Northern Territory's Health Minister, Natasha Fyles, later today. It will be interesting to see what she has to say in response to these allegations.
Absolutely. Matt, thanks so much for bringing this story, and do keep us posted.